prepared can any health system be for a once-in-a-lifetime pandemic? While advanced planning has helped countries such as Australia have a high-level approach for stockpiling critical supplies, availability of key medical staff, and the management of public health. However, in reality, when the pandemic struck, mobilisation became an ongoing exercise, not just for those infected or at risk from coronavirus, but the Australian public who have existing chronic health conditions. Priority areas have included those with comorbidity or a need for elective procedure that might prevent further health deterioration. Across the health system, COVID-19 has been highly disruptive, but until a vaccine is found, the Australian health system will need to manage the challenges. We spoke to a number of health industry associations to understand what their members are concerned about the most and how they're continuing to deliver healthcare.
Medicines Australia believes there are many reasons why it is important to be part of the continuity of care collaboration. We have realised during COVID-19 that there is nothing more important than your health. People with chronic or complex diseases and conditions need to ensure that they can monitor and maintain their best health during this time and avoid any long-term health consequences. Medicines are a critical part of both chronic and acute care. And for this reason, Medicines Australia believes that it is important for us to be part of the conversation to ensure that people continue to have access to and continue to take their medicines to ensure that they are healthy. Part of the continuity of care collaboration. We're conducting a survey to determine what are some of the barriers that for people to seek healthcare during this difficult time of lockdown restrictions. There may be many reasons why people are not going to their doctor or having pathology tests or taking their medicines appropriately. And it's important that we have consistent understanding of what those reasons are and can put in place some measures to assist people so that they can continue their care during this time. Health is so important to us all that we need to ensure that the messages are clear and consistent and that we understand how to safely access healthcare, safely access our medicines and continue to take them, and actively seek help if we need it.
Nurses originally found it difficult to access the PPE they needed to keep themselves, clinic staff and their patients safe. But as PPEs become more available, they've been able to not only adapt how they work within their clinics to maintain appropriate levels of safety and infection control, but also to make sure the health needs of patients have been met, and the introduction of telehealth has further enhanced their ability to do that. The Australian government made the right call with enabling nurses by extending services for chronic disease patients to be provided by general practice nurses. These changes have the potential to put a nurse into the home of every Australian with a chronic disease. And this has been great news for patients with conditions like diabetes and heart disease who are staying at home for fear of contracting the coronavirus. It means that nurses they know and that they trust are able to reach out and provide monitoring and support as part of the practice team. And this is critical for patient safety. We can't afford to have a second wave of disease sweep through Australia from chronic disease after we've actually managed to get past the COVID-19 pandemic. So telehealth has been a great addition. It's an important step forward for the treatment of vulnerable patients and their monitoring during this time, but it's also a great opportunity for us to explore how telehealth can actually improve broader chronic disease care in Australia post the pandemic as well.
Well, I live in Millsfield. It's in Hunter Valley, New South Wales, and since I was been going to all these appointments, my wife's driven me, and from Cessnock to Sydney for most of my other appointments.
I'm able to provide Lee with quite a lot of support actually, and not just Lee, his family as well. So he is managed by a team in Sydney. And that's quite difficult sometimes. The team he doesn't want or is able to travel to Sydney all the time. So I liaise with the nurse at the cancer centre down in Sydney so that if she needs one day she needed his oxygen levels done. It was silly to go all the way to Sydney to have oxygen levels done and come back home. So it was just easy for him to pop in here. I did his oxygen levels.
Well, particularly since the COVID-19 came along, it's been probably since that started, really. And, well, the benefits obviously for me were because I was high risk, having stage 4 cancer, not allowed to catch the COVID-19. It could have been pretty risky. So, yeah, that was been going on since that's been about 2 or 3 months, I guess. And, yeah, advantages are, well, not having to travel to Sydney was handy, but also just to stay healthy. I've been pretty well housebound for the last 5-6 months.
So that's some of the things that we do. Just wound checks, making sure his medication's okay. Providing emotional and social support for his family has been very important too. They've been on a roller coaster ride for the last few months and they weren't expecting him to survive at one point. So being able to have someone to touch base with and just provide reassurance and TLC has been really important, and they've really appreciated it.
Well, from infection control to flu clinics, practices need a nurse now, and they need them more than ever as part of their general practice team. There are so many ways that nurses contribute to the healthcare team, and some of them are risk identification, screening, triage, implementing and overseeing quality and infection control procedures, coordinating flu clinics and ensuring the safety of staff and patients, but also care planning and identifying and contacting at-risk patients, recalling them and ensuring their ongoing care. And beyond that, we know that nurses are highly educated. And in the case of general practice nurses, they're usually very experienced, usually with about 21 years of nursing experience and about 11 years of general practice experience specifically. Nurses can be immunisers, educators, wound managers, health promoters, patient advocates, and so much more. And when they're working to their full scope of practice, they free up doctors for additional consultations and more complex presentations. So a nurse working to their full scope of practice can enable a doctor to work to the highest form of their practice.
We've wanted to keep our patients safe. We've wanted to keep them at home, yet we still want to provide them with, quality care, which is it's very challenging. So getting everybody vaccinated against influenza this year presented quite a lot of challenges. Being able to get people in without having big groups, maintaining social distance and making sure that we had the best possible infection control was a huge challenge. But we managed to vaccinate about 1,000 people in the last 3 weeks, so I think we've done pretty well there.
Well, Catherine would call us and schedule appointments and say, you need to, well, for instance, I've got a flu shot coming up and, they're keeping on top of it. But, Catherine as a nurse has just been great because she's just keeping an eye on everything.
The RACGP has been concerned about patients being very fearful for looking after their healthcare needs and staying at home like they've been asked to do during COVID, but failing to seek appropriate medical care. So we've seen joining up with this collaboration as being a great way to remind everybody that your own personal health care is extraordinarily important and it needs to be looked after by your doctor at the right time, and telehealth is the best way to be able to do that.
My heart disease checkup can wait. It doesn't matter if I stop for a while. It's not like anything will happen.
Your GP. Expert advice when it matters most. Telephone, online and safe in-person consultations.
The Expert campaign is all about reminding people that the best person to go and talk to about your healthcare is your GP. And your GP is the person who knows you already, who you trust, that you've talked to, knows about your healthcare matters, and can, via telehealth or face-to-face, if absolutely needed, really assist you in managing your healthcare at this time and during these difficult circumstances.
Aside from the CCC, other sectors within the Australian health industry stepped up the response to COVID-19, despite its impact to the global supply chain and interruption to elective surgery.
COVID-19 has had an enormous impact on the medical technology industry. Firstly, as our health system stepped up to meet the challenges of the pandemic, Australia was effectively on a war footing, and the medical technology industry was on the front line, making sure we have the equipment and devices needed to diagnose patients, treat people and support them through our health system so that they can recover and get back to healthy lives again. Our industry performed a significant leadership role in coordinating the supply of essential medical devices and working with government to meet the challenges of the pandemic. MTAA stepped in to assist government in securing essential supplies of ventilators, test kits, PPE or personal protective equipment, and also broader ICU equipment. And we've seen companies who would normally be fierce competitors coming together, collaborate, provide resources, time and effort to ensure that Australia was well placed to meet the challenge. This was quite an extraordinary response and quite inspiring. And fortunately, Australia has been very successful in preparing our health system, securing supply of medical devices and equipment, and also squashing the curve and reducing COVID-19 infection rates.
Also need to note another decision that we confirmed this morning amongst the Premiers and Chief Ministers, and that is that the National Cabinet has endorsed the advice of the Medical Expert Panel, the AHPPC, that from today, midnight, the 25th of March until further notice, all elective surgery other than Category 1 and urgent, I stress very urgent Category 2 cases will be suspended.
Through the response of the government to restrict elective surgery, which was appropriate to ensure that our health system was well prepared, the reduction in elective surgery has seen a significant cutback in demand for medical technology, and that has resulted in significant financial stress for many medical technology companies. Our industry has also faced and will continue to face for quite some time significantly higher freight costs, increasing by more than 500%. So companies are doing everything they can to continue to support our high quality health system and to work through these challenges. Australia imports more than 80% of our medical devices and equipment from overseas. So we've worked hard to identify constraints in the global supply chain and to secure supply for Australia. We've also ramped up existing and new local manufacturing, including ventilators, PPE and ICU beds. Restrictions on elective surgery have recently eased and will be further relaxed over the coming weeks. It will be a gradual ramp up, and it will likely be quite some time before elective surgery fully returns to the levels of prior COVID-19. Of particular concern is that there are many Australians who are not maintaining their regular doctor visits for existing chronic conditions, or they're putting off seeing their doctor to get a test, an investigation or an immunisation. And that's due to fears of contracting COVID-19 or not wanting to burden our health system. So we potentially have a large number of undertreated or undiagnosed patients. And as we now have seen our success in squashing the curve, we have very low infection rates. Our health system is coping. We have plenty of capacity in our health system to treat patients and also to treat COVID-19 patients. It's essential that everyone keeps a close watch on their ongoing health care. Make sure you see your GP or see your specialist.
The Australian healthcare system has come under considerable strain from the current COVID-19 pandemic. Near daily briefings by federal and state leaders and the adherence by the majority of the Australian public has meant infection levels and the mortality rates have been much lower than other countries. The Australian health system has been able to perform higher numbers of COVID-19 tests per capita than many other countries. New legislation recently gave patients needing to access health services the option to contact a healthcare professional, be it a doctor or a registered nurse, through new MBS telehealth items. We spoke to patients who currently use telehealth to connect with their healthcare professional. However, first let's hear from a national body for consumer health on the drop in attendance of healthcare appointments and the ongoing need for public health literacy.
We know from feedback from organisational members like the Cancer Council, other chronic disease groups, from the work we do with organisations like the College of GPs and the pathology community, that visits to GPs are down and have been down in the lockdown period. The number of pathology tests for really important self-care and routine monitoring tests like HbA1cs for diabetes management are down. Now that's a concern. It's absolutely warranted that people have been fearful and worried about contracting coronavirus, but we also need to get the message across to people that it's also important to continue to maintain and self-manage your healthcare, particularly if you've got complex and chronic conditions.
My name is Phil. I'm in Sydney, and I have diabetes that I've managed to manage well during the COVID-19 crisis. As a diabetic, I need to visit my clinicians frequently, and whether that's just to renew my prescription or to consult with my endocrinologist on my daily care, I go to see a clinician at least a couple of times a month.
I'm Danielle. I live in St Leonards, New South Wales, and I feel that I've been proactively looking after my health over the last 6 months, keeping up my exercise, eating well, doing what I can. In relation to a previous cancer in 2018 and has seen my oncologist every 6 months, she phoned only this week. We were meant to see each other face to face. Obviously, she didn't have a look at my breast, but, she was actually able to talk me through how I was feeling from the medication that I'm on, and if I did have any health concerns or issues, then she would have seen me in person. Given the current COVID environment, I think any person would be cautious about going into a surgery or in to see a doctor.
It's particularly important for people with complex conditions to continue to think about and keep well, because if they don't, they're risking being more susceptible to more severe infections should they, in the unfortunate circumstance, contract the virus itself. But there are things that can be done around this. I mean, the first thing obviously is we need to get some good public messaging out there about how important it is for people not to stay away from healthcare services, that they should be going to their GP, that they should be going to allied health, that they should be filling the scripts that they would normally fill. As always, we want to keep people with complex and chronic conditions well managed in the community and not going to hospital if we can avoid that. And we need to avoid that because we need to keep our hospitals ready for and ever vigilant for COVID responsiveness, particularly when we remain concerned about second waves of COVID.
I had a recent health concern. I had a rash develop and I contacted my GP and made an appointment to see her. The rash got worse before I could actually get to see her, so I phoned again and they said, would I like a telehealth session? And I said, well, that would be great. I took some photos. She requested some photos of the rash, front and back. It was just in my truncal area. We took the photos, we emailed them to her so she had time to have a good look at it before the telehealth appointment. She was on time, she phoned, and we talked through sort of coming up to it, what had happened, how I was feeling, if there was any concerns, had I eaten something different, had I washed clothes differently, or whatever it had been. It was a really positive experience, and she also said, because I said, how do you take payment, for a telehealth episode or appointment, and she just said, no, it's all bulk billed. I did end up going and seeing a dermatologist in person. Obviously, they had to see the rash, but all precautions were taken. They had hand sanitizer. They were physically distancing all the people in the waiting room. They had chairs outside for people as well. The dermatologist herself had a mask and gloves on and stood away while we were talking, and then put the mask on and gloves on when she had to come closer.
The government responded really quickly to put in place a number of so-called telehealth measures, arrangements where GPs can claim patient rebates for doing non-face-to-face consultations, arrangements for contactless scripts so that you can fill a script and get it delivered to you without going out of the house, without seeing a pharmacy.
I've been longing for telehealth as a patient because I can do that a lot more efficiently, and certainly most of those encounters are just as easy to do remotely as they are to do face to face. So but now the MBS items are in place, of course, and with the requirements of isolation and COVID, it's now something that's available for someone like me to try. And I wouldn't want to go and see my doctor face to face now anyway, given COVID-19. So I've needed to go and see my GP to get a new prescription. That was a very good experience. It was very quick for both of us. It was very efficient. My GP knows me well, so we could bring things up on his screen in his office. He gave me my prescription. He then sent that to the pharmacist where I regularly get my medicine, and the pharmacist then delivered directly the medicine to me. So that was extremely convenient, and I really hope I can continue to do that going forward. In the same week, I had an appointment with my endocrinologist. He sent me my blood chemistry referral over email. I, of course, needed to go physically to have my blood chemistry taken. And then I, again, had a telephone call with him, during which we both looked at my diabetic control using the same application online. And again, we had a very efficient phone call, which I really valued, given that I have to do it so much. And the thought that I can continue doing that is very attractive.
The benefits of telehealth for me would have been that I'm not sitting in a waiting room with other sick people and people coughing and spluttering. You don't know what they've got. I know that they're extremely hygienic, but just being not in that environment, it probably makes sense not to be there if you don't have to. Also being obviously contagious. I didn't know whether I was contagious or not, so it was probably beneficial for the other patients. And the time saving is excellent. And, you know, I feel comfortable enough knowing my GP for so many years, she knows me, that, you know, I felt comfortable enough talking to her over the phone. I'm finding that telehealth, they're more on time. Doctors and specialists are more on time, which I think is an advantage for most busy people in today's society.
What we've seen with the COVID pandemic is how important it is to get the fundamental public health messages out to the community in a way that they can change their behaviour, and in a form, both in terms of information, plain English, in formats like different languages and in different settings, that they can not only understand but then act on. Because what we've really been needing to see people do is practice safe distancing, social distancing, practice good hand hygiene. They're the fundamentals of good public health messages at the best of times, but we've really needed to ramp up our efforts to get that information out there quickly. So health literacy and paying attention to how we do that effectively, as I said, in plain English and in formats and in settings where people go, in forms that people can understand, but importantly in ways that people comprehend and realise the why they're being asked to do things is really been the important thing here.
That wraps up our first segment on the continuity of healthcare under COVID-19. We'll be deep diving into a number of case studies over the remainder of the year from our association partners. Until then, please stay safe. My name is Ann Dow, and thank you very much for watching the Australian Health Journal.